What is up, y'all? Ray and Tyler Riff, and this is the first time that we've ever done one like external facing. Typically, we do these and we post them in our community for Engage Movement clients. But we were kind of talking about a topic today that I think a lot of people out there have questions, comments, concerns on. And so I kind of said, well, this is something that would be better served for maybe the YouTube channel. And maybe this is just like the early seed for something Tyler and I have been talking about for a long time.
Yeah, that's true. It
But
is.
I'll just leave that out there. So fill us in, Tyler. You had somebody reach out to you on Instagram. Give us a little background contextually. And I think that there are a lot of physical therapists or student physical therapists out there that are having these same thoughts. And so I'll kind of kick it over to you.
Yeah, so this woman reached out to me. She's in her third year of physical therapy school, and she's, starting to think about what the profession looks like after school. She messaged me saying, she doesn't think she wants to necessarily go the traditional route, speaking on maybe the type of people she was going to work with, as well as, the type of business structure she was going to work inside of or create for herself. And she wanted to gain some insight on my journey around building my cash practice and my remote coaching business and kind of everything in between. So we got on a call last week. She is in the middle of, clinical rotation phase and finishing up here, I think this year, and was concerned about her ability to stand her ground immediately after PT school for two different reasons. One, building a business without knowing how to build a business in
Yeah.
her perception, and like how she was going to, acquire clients and put together an effective business from like the LLC side. And another big concern was having enough clinical knowledge, clinical expertise to work with the type of clients she wants to work with. She hopes to work with people in the more athletic side of the spectrum, whether that's high school, college athletes, maybe even professional athletes someday, or the more casually ambitious athlete, the everyday person who is still has performance pursuits and wants to move athletically, maybe weekend warrior type thing. And something that came up a lot in the conversation was, you know, her feelings of insufficiency around what she knows and what she doesn't know. She brought up something like, I feel like the things we learn in PT school are like overly simple for what the people are going to need that I want to
Hmm.
work with. And she asked about what type of continuing education she should get. Should she work for someone for a while? If she works for someone, that's going to delay kind of like the building of her own business, but it'll give her mentorship. And she was just kind of in this like question phase of, I kind of know what I want, but I don't know what the most optimal way to,
Yeah.
to get there would be.
This is a really interesting topic because it kind of like raises that age-old question of like, when am I ready to start my business as a new medical provider? And I think that there's a couple of things here that I consider when I'm talking to people about this process. So, number one is I don't know what it is about the way that we are conditioned in school, but I feel like we come out with very little confidence in our clinical skill set. Whereas, and again, maybe this is just like a little observational bias. I don't know that I see that in like other professions, right?
Mm.
I feel like for whatever reason, like PTs have been constantly taught to question everything, which I think is really beneficial. But the problem that happens is that we then start to question ourselves.
Yeah.
And it kind of starts to bring our confidence down in thinking that like we don't know anything. And so it's kind of this interesting paradox that I feel like this seed is planted on, right? The second thing that I think happens is we are taught in school to manage the clients that the general healthcare system is designed to take care of. And the biggest difference when you go into the cash pay realm, especially when you go into like the cash pay athletic realm, is it is such a different clientele than what you have been prepared for in school, right? What you're prepared for in school is medical complexity, comorbidities, like in my opinion, what I felt like was really these big considerations for socioeconomic status, but more biased towards the lower end. And what I found when I went into the cash pay realm was like a lot of those things did not exist. So, way less medical complexity. You have clients that are the reason why they are there is because their mechanism of health has been taken away from them, so they're looking to get that back. And honestly, like from a socioeconomic standpoint, they're usually, middle class or above, right? That's just generally what I've seen. The third piece that I think is important to consider is I have not seen, with a few exceptions, I have not seen great promises and executions of mentorship in traditional physical therapy clinics. I think that what happens is it's like, oh yeah, we'll mentor you. But then from a reality standpoint, if you are being mentored, you are then not being productive. And if you're not being productive, you're then costing the clinic money.
Mhm.
And so I would be very wary for anybody out there that is accepting a job that has mentorship. I think you really need to like talk about what that actually looks like. Um, One of my jobs, the mentorship was like, here's a bunch of articles, go read these. And I was like, this isn't really like helpful for me, you know? And so I think balancing those three things is super important. What kind of stands out for you about that?
Yeah, the mentorship thing was something we chatted about on the phone in that I think there is valuable mentorship that comes from working for a clinic that is not yours, that has other
Yeah,
clinicians. I don't think it's as explicit as we think it's going to be, as our professors tell us we need, or as you are promised when you take the job. It often ends up being those little lunchtime questions, those the clinician kind of saw you doing something and offered their input, or maybe it's more of a ambiguous mentorship from the system itself, right? Seeing a high volume of patients having to make decisions on the fly, having to learn how to work
yeah,
efficiently, document quick. You get like mentored by the system itself versus meeting an hour every day for
yeah.
a year and talking about the complex cases. Again, I think you can find it. But if you were going to make a decision, let's consider the scenario that you are deciding whether to work for a clinic for a little while, build your business, or just go right into it after school. If you are doing that to gain mentorship, you need to be 100% certain that you are going to get legitimate mentorship. And if you
Hmm.
don't, you just need to understand and be aware and accept what mentorship really means if it's not like explicitly written in your contract and kind of upheld for the duration of that promised time. You know, I explained to her two different scenarios. Both have ended up okay. My one of my best friends, he did work for an insurance-based clinic, small. They only had one practice. There were three clinicians. One of the clinicians was the owner, had been practicing for a long time. He worked for them for about 2 years, and then right about the time that I moved here to open my practice, about 6 months before that, he opened a practice, and he is crushing it. He feels confident in himself. He has his own way of doing things, and he got what he needed from that world. He built a really successful business that allowed him to feel good about getting married and having a kid, and he still spent 2 years not building his business.
Yeah.
I was a traveler for 5 years, built an online business, and then, opened a practice. And we're both, from a practice standpoint, um, kind of in the same place. We just got there in slightly different ways. So yeah, I think the mentorship thing is something you definitely have to be aware of what that really means. I also really agree with the standpoint of, for some reason, physical therapists for sure are kind of groomed to feel like PT school isn't enough, whether
Mm,
it's some sort of talk within the students themselves, whether it comes from outside sources, whether it comes from the professors in kind of an undertoned way. I think we're taught that like you're not going to learn until you go to clinical rotations. And then we also have this shared disdain with clinical rotations. We leave them feeling like they didn't teach us anything.
they didn't scratch the itch.
Yeah, and the thought of the point you made about questioning is great. We are taught to question everything. We are also taught that we can't answer our own questions, and we need someone
Mm,
else to answer those questions for us for a long time. Um, on the point of not getting the right experience in clinical rotations, I disagree. I think whether you are shown what is good to do or what not is not good to do, you are gaining a ton of experience. You are
yeah.
learning what you don't like or what doesn't work for you, whether it's effective or not. Like whether you felt like the rotation was great from a clinical care perspective, you are learning a ton and you are more prepared than you were, you were before. Maybe we're going to talk about this, but I also think this thought of like I'm only prepared to treat the super acute, medically complex, kind of low level, I just want to feel good to get out of my car people, and I'm not prepared to treat or work with higher level, moderate level, everyday athletes or college, high school athletes. I think I think it's incorrect. I think we underestimate our clinical ability to adapt our skills to other people. We've learned so many concepts and ways to look at pain, ways to look at movement issues. It's not necessarily that you need to learn new exercises or you need to learn a whole new strength and conditioning system. I think it's often like you need to learn how to apply what you've learned
Yeah.
to various populations.
I think my only pushback on that last piece there is I think for you and I, that might be true because you and I probably went into PT school with a wider breadth of athletic experience, right?
Yeah,
And I don't mean like playing baseball, playing soccer. Like I mean like time in the weight room, understanding,
sure,
deadlifting, hinging, pressing, understanding how to write strength programs. And
sure.
so I think for us that might be a little easier to say. The thing that I think is important, the thing that I kind of needed was I kind of needed, or I think one of the things that was valuable to me was the volume, right? And it was
Yeah,
also like the blessing and the curse
yep,
because the volume allowed me to see patterns, but it also was the thing that kind of drained me energetically. But I kind of needed to see X amount of, rotator cuff symptoms and match that up with people's imaging and be like, oh, okay, like my brain was correct in an actual clinical setting where it wasn't just a
yeah,
test. So I do feel like that was important. I think the other thing is like sometimes you have to figure out what isn't for you so that you can figure out what is for you. And there is almost this like exclusionary criteria that happens when you take your first job and you're like, okay, this is exactly like what I didn't want to get into, and now I'm in
right.
it. And, for me, like the sweet spot for me was I had gone into clinical practice in 2014 with about like 6 years of like really serious strength and conditioning education at that point. And so after about 8, 9 months heading into, I started my business about a year out of PT school. I really felt like I knew how to take what I needed from the traditional clinical world and bring it into the cash-based world. Now,
Mm.
keep in mind, that the first eval I ever did in my cash clinic was absolute trash. Like it was goniometer out, it was manual muscle testing because like that's what I was taught that an eval looked like. And so what I had to do was I had to actually figure out like how do I start to create an evaluative system that actually matches the needs of my ideal clients. For me, that was CrossFitters, powerlifters, Olympic weightlifters. And I think that's really where some of this like paid mentorship can be superior to clinical
Yes.
mentorship. Because now what you get to do is Let's say you come into a program like ours. Well, our system is literally designed to evaluate and assess that type of person,
Yeah,
right?
yeah, yeah, yeah.
And we teach it to you through a lens of like the 80/20, in that like this is the 80% that I think you need, but then there's going to be the 20% that is going to be unique to you that I want you to bring in, and I want you to layer in like what feels authentic to you in the process. What are some, like, because you and I aren't going to see everything the same.
Right.
The way I pick up on pattern A might be different the way that you pick up on pattern A. And there might be something in there that helps you get a better result than me get a better result with that client.
Mm, I agree that I was going to bring up the point of if you leave PT school and you go and work in a traditional setting, traditional clinic, you're going to have that resistance point of 3 months to a year to 3 years where you're trying to figure out how to eval people using what you know.
Yeah,
If you leave PT school and you go work by yourself in a business you built, you're going to have the same resistance point. You're going to
that's a
get rid
good
of
point.
things that don't work. And I was a traveler for 5 years. I worked in 12 different settings or 12 different clinics, 4 different settings. I learned from a ton of people. I had been strength and conditioning, actively prescribing strength and conditioning for, I don't know, 7 years by the time I started my practice. And I still had the resistance of 3 months, 6 months, whatever it was, standing by myself with a patient in front of me being like, oh, why did I just do that? Like, I don't know if I
Yeah,
need that anymore, right? Or like evaluating the assessment afterwards and kind of being like, man, well, we're not going to do that next time. So
yeah.
I don't think there is going to be a perfect scenario where you hit your first eval on the back end of this with your own practice and you're like, yep, this is it. On, there is ways to make it faster, and those ways are often education or mentorship that's specifically designed for what you're looking for. Meaning, if you go take a couple of continuing education certifications, you're still going to have that resistance point of like, okay, how do I take this that's meant for strength and conditioning coaches or personal trainers and now apply it to my thing? I think there's a point at which you say like, you need to learn fitness, strength and conditioning framed for the clinical lens. Someone who's already done it, who's already figured out how they work together, and that's going to be more effective. And that was what we did was like,
Yeah.
I don't know how I'm going to evaluate someone. I know how to progress a squat. I know how to evaluate someone's hinge, but like, how do I fit that in, to an eval? And I don't know if taking an Exos course or getting your NASM cert or a PPSC course is going to do that for you as a clinician during the eval, unless it's specific.
So one of the things that I really lean into when I'm coaching and mentoring people is I can teach you the concept, but I can't learn the lesson for you.
Mm,
And so people kind of think that like when we say speeding up the process, that means that like you learn all the lessons, but it's no, you just have more exposure to the concept so that you pick up the lessons sooner.
yeah, 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 yeah.
And like when it comes to figuring out how to fit all these things in, I do think that there needs to be like this association of meaning attached to them. So, like, for example, when I'm working with somebody and I'm talking about like a single leg step up, there's an association of meaning that I have when it comes to applying a single leg step up to somebody's squat pattern, applying a single leg step up to somebody's running pattern, applying that to any sort of force production. And so what started to happen for me was over time, my internal system, my internal model started to make more and more sense, where instead of questioning the way that I was doing things, I would start to question everything else and saying like,
Mhm.
well, is that actually what I'm seeing? And then it allowed me to bring in components into my model instead of like just say like, well, my model's crap and nothing matters and go into this like nihilistic approach. And I think that ultimately, regardless of if you start from, start straight out the gate, you're still going to get clients good results because you are going to be constantly operating at the best of your current ability. But I think over time you will refine and you will tweak and you will figure out ways to get there faster. You will figure out ways maybe like you're getting there too fast and you actually need to go longer. There's all of these things that just by cannot be masked by anything other than time. So you like either way you have to pay the time debt.
Yeah.
The last little piece I'll say on that is I do think the more coaching experience you have, the earlier I think you'll feel confident starting. Because I think when you go into a traditional clinic with a lot of coaching experience, you will automatically kind of start to see yourself as like, oh, I get it. I get this.
Mm. And when you say coaching experience, it means being a coach.
Being a coach in whatever it is you are looking to get into. So, like, if you are looking to, like, for me, it was CrossFit, but there are probably people out there that are, rowing specific, running specific. And maybe it's not even coaching, maybe it is just understanding the biomechanics of that sport and then starting to view it through a PT lens.
Yeah.
Like,
Yeah.
I
Yeah.
think, I think if there was anything that is a cheat code, it's that.
Yeah. It's the time exposure cost or price to pay is a big thing to realize. Let's say you have the ambitions to work with more athletic populations. You know, one way to do that is to go have all of this experience with those populations. The other thought process perspective here is like if you open a practice and you eventually want
Hmm.
to work with athletic populations, for now, you make sure that you are accepting or marketing to or like doing really well with the clinicians or the patients you can treat really well with and
Yeah.
allow the time and exposure to get you better at working with populations you want to get to. It's the same exposure, it's the same internship. It's just maybe taking longer on your own because the only thing that the internship does is just exposes you to the people you want to work with
Yeah.
sooner.
Yeah.
You know, when I started working here, I still had that thought process of like insufficiency, fear around my clinical expertise. So I wasn't being real outspoken about wanting to work with like the athletic 9 to 5 or like that weekend
Hmm.
warrior. I was just kind of taking whoever. Maybe there was people I would refer out to that 6 months after that I would be like, let's go, let's work together. And then eventually I gained the confidence to work with the people that I want to work with, and here we are.
The first person we can expect ideal clients to believe in us before we believe in ourselves.
Mm,
And so the biggest thing that you need to lean into is that you are still learning and you always will be, but that shouldn't prevent you from starting.
yeah.
And so I think a lot of people out there, you have to figure out the sweet spot for you. Like if I was like rethinking this whole process, what I actually think would be a really good sweet spot would be actually finding a job that was like part-time, that was like 20 hours a week or 24 hours a week. I actually think that would be awesome to be like 3 days, 2 days, 3 days in a clinic where you're seeing just traditional people. The rest of the time, maybe you were shadowing, you were applying, you were coaching at gyms, you were building a network, like you are bringing your PT brain into the space that you want to get into. But again, I think from a societal level, that's such like a backward strategy where it's like, well, you just became a physical therapist. You need to work 40 hours clinically. You need to put on your khakis and polo and get into the clinic and like do your thing. And that only exists because society tells us it exists.
Yeah,
So
sunk
if,
cost fallacy.
yeah, it's like if you guys are going to leave here with anything, it's that you don't need to follow the most traditional path. You need to figure out a realm of a mix and match of the things that actually feed you into becoming the clinician that you need to become. Because I promise, if you go down the traditional path, you will probably start to see some of that burnout happen.
Yeah, yeah, yeah. And
And it,
and and get stuck. That was something I brought up
and
with her
get
too, is
stuck
like,
because then it gets scary to leave.
yeah, that's the risk. I think
Yeah.
there's a ton of benefits, but you might get stuck. And look, everything that you do, once you've decided that you are going to be a business owner, an entrepreneur, is a strategic business decision,
Hmm.
right? Paying for a business mentorship, strategic business decision. But it might not be any different or better than purposefully taking a part-time job in a traditional clinic. That's still strategic. You are strategically trying to have some backbone financially, trying to learn the ways, get your reps in. It's just like when Ray and I try some different content strategy or lead funnel strategy that we are unsure if it's going to work. So there's the risk.
Hmm.
It maybe doesn't align with what we've been doing, right? So there's the work different setting than you want to do as a business owner.
Hmm.
But like it's strategic in that like I need to see what happens and so I can iterate down the road, you know? I
Yeah.
think people get this idea of wanting to be an entrepreneur in their head and like anything else but that is incorrect. And I don't know if I agree.
No, there's not a right or a wrong answer. Some people need to dip their toes into entrepreneurship just to figure out that it's not for them,
Oh yeah,
right?
yeah.
But literally one of the strategies that we talk about, because most of our clients, 95% of our clients, are working in traditional outpatient orthopedic clinics, right? And the biggest problem with that setting is the schedule limitation and the, inflexibility to build your business because all you have accessible to you is nights, weekends, sometimes one weekday if you're working 410s.
Mhm.
So literally one of the exit strategies is you need to bring money in to feed your family, to keep a roof over your head, to have your basic needs met. PRN work, go to part-time home health, short-term sacrifice for long-term gain. I have seen people move from outpatient orthopedic to part-time home health and literally make the same amount of money in half the time.
Yeah.
I get it, you don't want to do that setting, but it is short term so that you can be in the setting that you want, that you can do the things that you want to do, that you can build the business that you want to create. And so hopefully like this conversation has been helpful for you guys. Um, Tyler, I will post this in our community too because I feel like it's valuable for them, for some people that are maybe early on in the journey thinking about making the leap. But when we post this to YouTube, where can people find you?
Yeah, the best place is my Instagram. So tylercalasi.dpt. I'm sure Ray will put it below. You can also find me at my website, tylercalasi.com. Currently writing a book. I'm going to shamelessly plug that in there.
Sweet.
So check that out on the journey of writing a book to help casually ambitious everyday athletes, navigate pain if you want to see what that's like. But yeah, that's where you can find me.
Yeah. And I will end by saying if you are thinking of starting this journey, reach out to people, have conversations with people, start consuming free content.
Yes.
Um, if you guys want to find me, Instagram is my most popular platform at Ray Gorman DPT. You can also head over to engagemovement.com. We have some free resources there if you're looking to start a business. And this has been fun, man. Maybe this is the
Yes.
the first of many. So,
Yeah, it will be for
all
sure.
right, y'all. Have a great rest of your day. And Tyler, great chatting with you, brother.